to be effective, you need a large number of the population to be vaccinated, and that kind of like brings the politics into it. So everybody's saying how wonderful we've got this vaccine, but that's not the solution. That's part of the solution. Now you've got this vaccine. You got to make it. And there's interesting politics about rich countries and poor countries, about the UK and America buying up everything, and there's nothing left for poor countries or something like that. But even within a society like the UK, how do you make sure that everybody gets it? So we've seen the same issues with testing. What happened in Tower Hamlets was the wrong type of people were coming and getting themselves tested. So it was basically affluent, say white middle class kind of ish. That's the descriptor that's used, turning up and getting themselves tested, where the actual people that needed to be tested were people of low income, and basically ethnic minority. Those were the ones that were supposed, and there's still issues around that. We're not getting enough people tested, sort of ish, the right type. So it's the same thing with the vaccine. I could see the vaccines coming up, or everybody who's upwardly mobile ringing up their GP and getting themselves done. But then there's loads of people who are not upwardly mobile. You've got people doing 12-hour shifts. You don't have time to ring the GP up, or more than 12 hours. A lot of people doing more than 12 hours. You've got people with language issues. You've got people who are on the run, undocumented migrants. I think there's 1 million undocumented migrants in London alone. That's just in London. You've got very marginalized communities like traveller communities, or other minority communities that are very marginalized, very isolated. How do you get the vaccine out to those people? And that comes on top of a decade of where we're having to cut public services, and inequality has grown. So in Tower Hamlets, it's the third richest borough, but we have the highest child poverty rates. I think 60% of all children grow up in poverty here, in the shadows of Canary Wharf and the City of London. So the issue is, we need to overcome those barriers to actually administer the vaccine, to get the uptake. Is that would you it's a different approach to healthcare, because you have to be proactive. You can't wait for people to turn up. You have to basically go out there with the needles and start jabbing people, kind of issue. You can't expect them to turn up to you.
So I think what needs to be addressed before that, and what you're doing very helpfully in this, is looking at issues of trust.
Yeah.
One of the big issues we've had, if you look at, say, the UK, and you look at examples like New Zealand, is the lack of trust within existing political, economic, and even health provisions, that services that are there within the UK, as opposed to, say, widespread trust and support for policy that's been there in countries such as New Zealand. And the debates we're having now about why it's important for people to get the vaccine, and why it is people are skeptical about this, and why it's likely that anywhere between 40 and 50% of the UK population may turn around and say, no, thank you.
Yeah.
To what seems to be a relatively safe process. I think needs us to look at this issue of trust and how we gain that trust and how we ensure we're transparent. And you're right. We've spent a decade underfunding public health since 2012, year on year, cutting the branch that we're sitting on and making sure that the vital services that we need to identify potential pressures and threats to the health and well-being of communities are affected. And most affected where they're most needed. This is the irony. The greatest public health budget cuts have been in spaces where they are actually needed.
Yeah. I think there was a study done. The more deprived the area, the larger the public health budget cut was. And it's interesting, there's probably a correlation between the high COVID infection rates in those areas as well. So there's a direct correlation between cuts in public funding and that. And it's the same thing with knife crime, where you cut youth services, you have a mirroring effect to knife crime. But we are where we are now. You have to administer this. For it to work, I think 60 to 70% of the population need to be vaccinated to bring it under control. And then to basically, for a population to have immunity as a whole against the virus, you need 94% uptake. How are we going to do that where like more than half, like say in Tower Hamlets, majority of the people are on the breadline?
So ironically, the thing that will help us is the scarcity of vaccine.
Really? Explain.
So in a situation where you have a limited number of vaccines now available, and where there is a scarcity, there are multiple producers, then access through private means has to be restricted. And you can have a sensibly devised policy on the part of government and on the part of the NHS, where high-risk groups are defined. And that's exactly what's happening, where priorities are being set. And where there's a lack, deciding here that you need to vaccinate people who are most at risk. And if you remember the figures that we looked at the beginning, 1 in 10, more than 1 in 10 of anyone who gets the infection above the age of 75 dies of it. Then that almost immediately tells you, look, if this is such a threat to the life and well-being of the elderly, let's vaccinate the elderly first. So those above the age of 80 and in care homes, and those looking after them, who might unwittingly pass on this illness to them or pass it would be the highest priority. And then sequentially going down the age tree and also going out into a population that is less, has less underlying illness. So you can have a program of rolling out the vaccine without necessarily having queue jumping by the worried well, or people who have access to information and resources, as opposed to those who need it but don't have access to information or resource. And that's why I'm saying that the shortage of vaccine at present means that a policy has to be put in place, and the presence of that policy enables this to be done more fairly.
But you have